I'm a very active person, very involved with my children. We're a sports family on the go all the time. My pain presented in April of 2017, and I knew immediately something was wrong. I was in massive pain. The pain had come on to where it was dragging my leg. I couldn't bend over. My glutes were seized up. The pain had spread all the way down my right leg into the bottom of my foot. My primary care physician referred me to Dr. Perez-Cruet at Michigan Head and Spine Institute.
When Deanna first came to me, she complained of debilitating back pain and increasing difficulty walking. She's an extremely active person. She takes excellent care of herself. The first thing we did, of course, was take a patient history. And then after that, we proceeded with x-rays and then MRI. These are her x-rays when she first came to see me. And what you can see, this is a lateral x-ray taken from the side. This is what we call an AP, or an anterior posterior, taken front to back. And you can see this at L4-5, what we call a spondylolisthesis. This condition is relatively common. We tend to see it 2/3 in women, most commonly at the L4-5 segment. And this is a MRI. We call this a T2 weighted sagittal and a T2 weighted axial. And what you can see here, where the green line is, things are very pinched, very tight. This is the L4 vertebral body. This is the L5 vertebral body. And you can see right here where it's pinched. You can even see the nerves, how they're kind of bunched up right above that area that we call lumbar stenosis. If we look at a cut right through that area, this is called an axial. You can see she has severe lumbar stenosis where the nerves are. You can see where this is what we call a synovial cyst, and the joint is very degenerated. Just for a comparative analysis, you can look at the level above, which is relatively normal, the normal size of joints. You can see how the nerves, you can even see the individual nerve rootlets, how they're nice and open. And as we come down to that level of spondylolisthesis, you can see where the nerves are completely pinched here. So this is a very painful condition for patients. This is a condition we call L4-5 grade 1 spondylolisthesis with associated stenosis.
At my very first visit, within 4 minutes of Dr. Perez-Cruet walking into the room and showing me my MRI and my report and telling me what my diagnosis was, and what he could offer me to rectify that. Within those first 4 minutes, I decided right then and there that if I was to go forward with any back surgery, that he would become my surgeon.
So the treatment for this, we've developed a minimally invasive procedure that allows us to operate through 2 small incisions. The advantage of that is that it preserves the normal anatomy of the spine. We get down to the spine with a 1-step dilator that allows us to preserve the muscles and their structures and their attachments to the spine. And then we operate through a tube, and we can do the decompression or take the pressure off the nerves through that tube. All the bone we remove is recycled. We then go into the disc space here. You can see the disc space. We've gone into the disc space. The first part was to take the pressure off of the nerves. We then go into the disc space and put this little spacer, and then around that spacer is her own bone. And then we put these screws in that allows us to, you can see her alignment is perfect now. She doesn't have the spondylolisthesis. We've restored the alignment of the spine, restored the height of the disc. All her disc is filled with bone graft, and these patients have excellent outcomes. Once this heals completely, she can do whatever she wants to do. Go skiing, downhill skiing, even water skiing, running, jogging. So this is how we feel we can provide outstanding outcomes for these patients.
Today I am 14 weeks post-op. So, you're on restriction for 12 weeks. So I'm 2 weeks out of the back brace and 2 weeks off restriction. And I am happy to report that I'm about 90% better. And I'll go as far as to say that I am lifting the same amount of weights in the gym. And I am, 90-95% pain-free. There's some healing pain involved, and there's some muscle, regeneration with being in the brace and not using all your muscles and having everything activate again. So I'm very, very satisfied.